Doctor, my eyes are ready to see clearly. It's a beautiful day, so I want to be able to see clearly. I feel like it's a blessing to be able to see clearly. It's 5 minutes after 9 o'clock. Dr. Micheal Lange is in the studio to answer your questions about your eyes, your eyesight, and your nutritional needs and how it all connects with your eyes and your body and everything like that. And the phone number right now is 622-9622. Dr. Lange recommends all the time for us to get plenty of sleep. So the first question is, good morning. How was did you have a good night?
I don't know. Maybe I look a little tired today. Yeah, I was writing a lot of articles last night and doing a lot of research, and I just went to bed just a little while ago.
Just a little while.
And the alarm went off, and I said, whoa, I got to get over to the radio station.
Is that what you sleep in? You sleep in your blue...
like jammies and work clothes. I mean, I wear this everywhere except church.
Everywhere except church. Well, good morning. Can I share with Dr. Lange your personal story? Robin's husband had a cataract taken out, and he'll have the second one taken out, what, this week?
A week from Thursday.
A week from Thursday. And he was telling us that he can see colors, that he had a black comb, and he thought it was black, it was blue. He had a black shirt, they thought it was black, it was blue. He had all the colors that he never knew he couldn't see. He can see with one eye. Now the other eye in a week or so.
Right, and he can't wait to have the other cataract removed now.
And I guess you've told us that story many times from people who've had cataract surgery, but it's just to hear it from somebody firsthand. And he says he sees colors brighter than he ever has seen them, which means it's such a slow process.
Right.
We don't realize we're losing it.
Cataracts are a very slow process most of the time. Some cataracts are very rapidly growing. Some traumatic cataracts and steroid-induced cataracts can be fairly rapidly onset. Most cataracts, called a nuclear sclerotic type of cataract, comes on very slowly. And this is a normal age-related process. I mean, there's certain things we get if we live long enough. Taxes, gray hair, wrinkles, and cataracts, all right? I've never looked in a 70, 75-year-old eye and not seen a patient with a cataract.
Really?
Now, whether or not they have to be removed is a different question. But the first symptom of cataract is your vision just isn't as clear as you'd like it. Your colors are a little bit washed out. You get a little bit of glare from cars' headlights, a starburst effect around cars' headlights. The sun is bothersome. And then I like to tell my patients, you know, the time to remove that cataract is when your quality of vision is affecting your quality of life. When we tell you, this is the best we can make you see, Mr. Jones, with a new pair of glasses or with contacts. And if you're not satisfied with that vision, that's when that cataract needs to be removed. So it's going to be different for each individual. Many people out there, used to be fighter pilots or whatever, athletes, and their vision's 20/25 or 20/30. They're ready to have that cataract removed. But by the same token, some people aren't driving anymore, and they're just sitting on the porch rocking or watching television. Their vision might be 20/60, 20/70, even 20/80, and they still may not feel that that's time for that cataract to be removed.
That's true.
But cataract surgery's come a long way, especially with the advent of the new small incision, no suture, topical anesthetic cataract surgical procedure. It's about a 10-minute procedure. There's no needles involved. There's no sutures involved. And now we actually have lasers that are actually used to make the incision and to help the patient see a little bit better, to remove astigmatism and things like that. So we have laser cataract surgery here today. It's not too vogue yet because it's relatively expensive and you have to pay the difference. So it's probably about $1,000 more out of pocket to have laser cataract surgery. And still the jury's out on it, especially with Lange Eye Care and Associates, because we're not seeing any huge benefit from laser cataract surgery. And, you know, right now, contrary to what some people are saying, we're still in a recession, in my opinion. Maybe we're trying to pull out of it, but, you know, a dollar saved is a dollar gained. So I don't know a lot of companies that are pushing laser cataract surgery yet. A few eye care centers are, because they've invested in it, so they want to use it, and they're going to charge you a big difference. So cataract surgery has come a long way. It's not something to be frightened of because it's a relatively simple procedure. I mean, there's tens of thousands of cataract surgery procedures done yearly, so I think it's the most common surgical procedure. So if you're not satisfied with your vision, you know, it may be a cataract, so get into your local optometrist, your ophthalmologist. Certainly come to any of the 9 Lange Eye Care locations. We do a lot of cataract surgery. I got a great group of cataract surgeons on staff.
And it was one of your surgeons that helped out Ronnie, Robin's husband.
It was Dr. Hunt, and he and his staff are just phenomenal. Makes you feel comfortable from day one.
Right. Dr. Seaborn Hunt is a fantastic cataract surgeon, and he does surgery in Ocala, and also he can be seen at the Lange Eye Institute in the Villages. That's our large center. You know, it's close to a 40,000 square foot center right there in the heart of the Villages, right there at 466 and County Road 101. It's kind of a health center because we also have a great group of retina surgeons upstairs at the Lange Eye Institute. We've got a blood lab, doctors' laboratories, Southern Trace Chiropractic Associates, great group of chiropractors, as well as massage therapists. And we have a dental group coming in, so we're going to have a dental facility there as well. And then we got another 3,000 square feet for future expansion for Lange Eye Care.
Oh, wow. I wonder what you're going to put in there. Do you know what? The fact that he's had one done, I'm just guessing, that before that one he was probably nervous. But now that he sees so well with the eye that was completed, he probably doesn't have the same nervousness about the second one, and in fact is probably looking forward to having both eyes seeing that crystal clear.
You're absolutely right, Larry. A lot of the apprehension is going to be gone now. You're kind of nervous for that first one. I mean, it's eye surgery, let's face it, so it's not something people look forward to. But you find out how simple it really is and how quick and painless, and you find out the instant gratification you get. And then you look forward to having the other eye done, because there's a little period of time right now where you have a little bit of unbalance, a little bit of what we call anisometropia, where you have one cataract missing and you still have one cataract. So things are, the image sizes are a little bit different, colors are a little bit different, clarity between both eyes is a little bit different. So it throws you off for a couple of weeks. But once that other cataract is removed, then his vision is going to be absolutely incredible, better than it's been since he's probably been a kid.
Yeah.
And, you know, with cataract surgery now we have a lot of varieties. If you have astigmatism, we have astigmatic implants we can put in. If you want to have elimination of reading glasses, we can put a multifocal implant in, something like the Alcon Restore multifocal. But we have to actually screen each individual patient very carefully. We got to look at what their lifestyle, what their job, what their future holds for them, what kind of sports they play, if they drive a lot at night. We have to really screen the patient very carefully before recommending specific types of implants. And then these premium implants are not covered by your insurance or Medicare, so it is an out-of-pocket expense. It's usually not a dramatic price. You know, a multifocal implant is usually around $1,500 per eye, above and beyond what your Medicare is going to cover. Mm-hmm. So cataract surgery has come a long way, and it's definitely a great procedure. We're blessed to have a lot of great ophthalmologists and optometrists throughout the great state of Florida. So you got a lot of good doctors to pick from. And I say, if you're a snowbird and you're up north, wait till you come down south and have your cataract removed, because these guys and gals have a lot of experience at removing these cataracts.
The phone number here right now is 622-9622 if you would like to ask Dr. Lange a question. We're talking about cataracts now, but you can change the subject. You're welcome to do that. And, of course, if you'd prefer an in-person interview with the doctor over at the Lange Eye Care Empire.
I like that, the Empire.
What number would they call, Doctor?
You can call our main number in Ocala, and that's 237-3768, 237-3768. We have a new Tampa office that's opening in about 2 weeks. It's over on Bruce B. Downs, right next to Panera Bread. We just opened an office about 3 months ago or so in Citrus Hills. So anybody over in the Citrus Hills area, right there in the Publix Plaza, right across from that really nice neighborhood, Terra Verde, I think, or I don't even know how I can't pronounce it.
I think that's the name of it, yeah. Very, very nice.
Do some of our lifestyle choices make a cataract happen earlier? Like Ronnie is really only in his 60s. He's not that old, really.
Absolutely.
So, for example, he was a smoker. Could that have contributed? He doesn't anymore, but he was.
One of the biggest factors is absolutely smoking. Smoking lowers serum antioxidant levels in the entire body, and it predisposes you to developing cataracts at a younger age and also macular degeneration. So smoking is one of the biggest negative attributes toward developing eye disease. So obviously we need to have smoking cessation classes everywhere, right? We got to stop smoking. If you're overweight, you're going to be more prone to developing macular degeneration cataracts, because what happens is if you're overweight, the lutein and the zeaxanthin from the foods that you're eating, the lutein from the dark green leafy vegetables, the zeaxanthin from the orange bell peppers and the goji berries, and even the astaxanthin from the wild Alaskan salmon. These are 3 carotenoids that if you consume more of them, it may actually slow down cataract formation. But what happens is if you're overweight, these carotenoids actually go toward the fat in your body. So if you have a little bit of love handles, you got to try to lose those. So ideally, if you smoke, stop smoking. If you're overweight, exercise, get down to your ideal body weight. Poor nutrition also, eating the typical American diet, which we've talked about, for years on this show. the typical American diet is a pro-inflammatory diet. It's very high in omega-6. And so these omega-6s actually create inflammation in the body and increase your risk of all sorts of diseases in the eye, including cataracts. So adjusting your diet, adjusting your weight, not smoking, and then out in the sun. If you're out in the sun, you got to wear a good pair of sunglasses. You know, and the best lens color is a brownish amber lens or even an orangish red lens. Those are better than gray lenses or gray, green, or blue lenses because they not only block the UV light, they block the HIV, high-intensity visible spectrum of the sun, which is the blue light, which is the most damaging to the lens and the retina, not to mention the skin around the eyes.
Oh, wow.
So now we can lose weight, we can eat properly, we can stop smoking, we can wear blue-blocking sunglasses. And then you can take a supplement that may help slow down cataract formation, usually won't reverse it, but, you know, a formula I created called Fortify Focus, it has those 3 carotenoids in it. It has the lutein, the zeaxanthin, and the astaxanthin, but also green tea polyphenols, the lutein, the zeaxanthin we mentioned, the green tea polyphenols, curcumin and turmeric, even vitamin C. All of these things have been shown to actually help slow down age-related degenerative aspects in the lens in the eye and in the retina. And that's why I developed the Fortify vitamin lines.
Yeah.
You know, whether it's the Fortify One-A-Day multivitamin, Fortify Complete Plus, or Fortify Complete Macular Defense, you combine the Fortify Focus with it, and it really can help with free radical damage in the entire body, including the eye.
And we do have a few phone calls, actually. Let me go to them. Good morning. You're on the air with Dr. Lange. Are you there? Well, let me go to the next one. Good morning. You're on the air with Dr. Lange.
Good morning.
Morning.
How are you doing?
Very good. And yourself?
Good. Hey, we're almost to Traverse, and I'm still getting signal.
All right. Powerful station.
Yeah. We're on our way to Stanford.
Okay.
We're not protesting, though.
Okay.
Oh, okay. Having a fun day.
Yeah. Hey, I was wondering, I'm getting to that dreaded age where women start getting hot flashes and that. Is there any vitamin you recommend for that?
Wow.
I'm listening.
I know you're an eye doctor, but I know you're very knowledgeable of vitamins. So.
Right. You know, that's a long show in itself. If you actually sent me an email, let me give you my email address. eyedude92@aol.com. So EYEDUDE92@aol.com. I can send you a lot of really good information. I mean, something simple to do for everybody at any age, but especially, you know, women, you know, around 35, 40 years of age.
You can keep going higher. I'm a little above that.
You know, one thing is adjusting the diet, obviously, but, you know, avoid drinking water and fluids out of plastic bottles, especially plastic bottles that leach bisphenols into your system. So turn the bottle over. If it has number 7 on it, throw it in the garbage can. Number 7 bottles are these sports bottles you use when you go out running or biking, and they're colorful. Those have bisphenols. That causes endocrine disruption. It'll cause hormonal craziness, okay? And then also anything with dyes in it, because, you know, everything you eat these days, even the vitamins, if they're not fortified, the vitamins have dyes in them. The foods that you have, you got to learn to read labels, because when you're reading these labels, you're going to see there's FD&C, red, yellow, and blue dye. So those are just 2 simple things I can tell you really quickly without getting into a lot of detail. Avoid the plastic bottles and the dyes.
Deal, you know, was good. Soy, you know, I was reading about that, but I don't know. You know, they said women in Asia and that they don't really go through the same things with hot flashes that the American women do because they have so much soy in their diet.
Right. Well, you know, there's a catch-22. Soy has some good benefits and some bad benefits. I've been avoiding a lot of soy over the last few years because most soy is genetically modified now. And so you don't know what you're getting. Soy that's genetically modified has a lot of pesticide built up in it. Pesticides will cause a lot of problems, including cancer. Remember, everything in moderation. If you're going to eat soy, you got to eat fermented soy. So miso and tempeh. Don't eat the tofu. Don't eat the edamame. And if you do eat it, make sure it's organically grown and you're trusting the label. But remember, soy and red wine or soy extract and resveratrol in a high dosage also causes endocrine disruption and will cause your hormones to go crazy, all right?
Good thing I don't drink red wine. No, it's a good thing Huey's male because he drinks a lot of that. He's the red wine drinker in the family.
Excellent.
But the same thing for men. You know, it'll put men in male menopause early and make their testosterone levels go down. And so, you know, I don't recommend drinking soy milk for men and eating soy protein or eating a lot of soy. I mean, occasionally you go to the Thai restaurant or Japanese restaurant, you can get the edamame occasionally. Like I said, everything in moderation.
Yeah, I don't like soy to be. I mean, I've never really, you know, tofu and soy. It wasn't. I'd rather have a cheese curd. So you know, than have so. I was thinking of just taking the pill. You know, the soy vitamin. You know?
Right.
But I'll go online and read your website, and maybe it'll light me a little on that.
Okay, that'll work. And remember to shoot me an email, just idude92@aol.com. But a really good website, a blog site that has a lot on nutrition, and it links up to a lot of other places, is drmicheallange.com. Just simply drmicheallange.com.
Okay, I'll go on there.
All right, take care and drive safely.
Okay, thank you. Bye.
And I'd like to mention that on your website you also have links to a lot of the programs you've done on radio, not just this station but other stations. So there's an unbelievably large amount of information on your website. So.
Right. There's a lot of archives from past radio shows for years and years and years. There actually is a link from drmicheallange.com to Fortify Vitamins. There's a link to our YouTube channel, which is called Ocular Health Channel. There's some links now to some new Facebook pages. So we're going to invite everybody to join some of our Facebooks. Our Lange Sun and Nutrition Center in Clearwater, we've finally got a Facebook page. So go to Lange Sun and Nutrition. You can join our Facebook page. And also Fortify Vitamins. We've put together a Facebook page at Fortify Vitamins, and that's FORTIFEYE, kind of a play on words. And on both of those websites, they got a lot of good articles that I've written and some videos that I've produced and things of this nature about nutrition, about slowing down the aging in the entire body. And what we did, you know, a lot of things I talk about on the radio, we have at our nutrition center. And that's why I started the Lange Sun and Nutrition Center in Clearwater, is to be able to have a place people could go and buy the water that's in glass bottles instead of plastic bottles, the organic goji berries, the organic green tea, you know, the new Manuka honey, the coconut oil, things I talk about on our program are all available at that center. So what we did recently, just to help the public out, is we actually have a menu of what we have now. If you go to drmicheallange.com, DR with no period after it, and then just go, there's a little section that says Lange Sun and Nutrition Center, click on it, and it shows the entire menu with the prices of everything we have. And you can actually call the toll-free number, talk to Arlene, and she'll package it up and send it to your house. So it's a way you can actually shop for organic foods without having to leave your house.
By the way, I saw a photo on Facebook of you with your son. He's taller than you now.
Oh, Logan has grown like a weed. You know, I think it's the food they're feeding him over at Admiral Farragut, because he's at Admiral Farragut in St. Pete now. As sophomore, is that his grades are straight A's and B's now. It really changed his life. He needed a little structure.
Wow.
But yeah, he's a big boy. I mean, he's 200 pounds now and about almost 6 foot tall.
Mm-hmm.
He's been lifting a lot of weights, playing baseball, and you know, life is good. He's going in the right direction. I'm real proud of him.
Yeah, you could tell. You guys you've got a good family. I just love seeing those posts.
And you saw Mackenzie. She's also
I did
growing.
see Mackenzie.
She's beautiful.
Yes.
Yeah, for Easter she had 4 Easter egg hunts.
Aw.
Oh, really?
Yeah, she was really in hog heaven.
She just went to a lot of different places?
Well, she had one at her school, at her kindergarten, and then she had one, we were at the beach for this, at the park next to our beach home, and then she had the one that we had Easter morning at the home, and then she had another one at church Easter morning.
Mm-hmm.
You know, and speaking of that, what is your thought on eggs? We hear 2 different things. One says don't eat any. One says don't eat the egg yolk, and one says you can eat the whole thing. There's nothing wrong with it.
It's interesting. Al Rosa came over last night to my house and cooked some organic grass-fed beef and organic eggs, and he picked the eggs.
Oh, really?
Picked the eggs right from his pen, because he has a lot of organic eggs at Rosa's Farms, and brought a couple of dozen of them over. And you know, I didn't really realize this. You don't have to. Most people that have any farming background would know this. You don't have to refrigerate those eggs. I mean, they'll stay out for a couple of weeks.
Really?
Oh, really?
But eggs, I think. Remember, like I said, everything in moderation. Eggs are a very good source of protein. I mean, you can eat the whole egg. Now, don't eat 8 a day, but if you want to eat a couple of eggs a day, I think that's fine. And if you want to make an egg omelet and use, 3 egg whites and only 1 egg yolk, and then put a lot of good organic vegetables in it, it's a great source of protein.
Man.
And, it's not going to raise your cholesterol unless you overdo it. All right, so eggs are good. There's certain nutrients in the yolk that are beneficial. There's certain vitamins, the lutein, the biotin, things of this nature. There's a lot of other things in the yolk that are good for you. But if you just, let's say you're a bodybuilder cutting up for a contest, or if you're on a weight loss program, all the fat is in the yolk as well, and the cholesterol. So if you eat the egg whites, that's just a very great source of protein, a really good source of protein. But you want to get free-range eggs, organically raised free-range eggs.
And you have another phone call. Good morning. You're on the air with Dr. Lange.
Can you tell me if they do anything if you get too much sleep?
If you get too much sleep?
Yeah.
Yeah. Will that affect you too much
I
sleep?
would love to have that problem. The only time I used to have that problem was back in my drinking days at LSU. All right.
I'm on medication, and
right.
every time I eat something, about 15 minutes, I'm asleep.
Yeah, I mean, many medications will actually cause you to get very tired and very sleepy, and that is something that you really need to discuss with the physician that put you on those medications. I mean, you're just having some of the unwanted side effects, and you got to work very carefully with your physician to determine which one of those particular medications is causing that, and maybe see if they can't taper you off of it or actually change you to a different medication. I mean, too much sleep is not a good thing. By the same token, too little sleep is bad, too much sleep is bad. You want to be up and about outdoors in the sun, getting a little exercise. Too much sleep can actually cause depression, believe it or not. And, we don't need to be getting depressed if we don't have to. So you got to counsel with your physician that has you on these medications.
Yeah.
Last night I went to bed at 5:30, and I woke up this morning at 7. I still feel sleepy.
That's a long time.
Yeah, that's quite a bit of sleep. You need to talk with your physician about that. That's an area that I'd like to be able to help you with, but also it also depends on your diet. I mean, if you're not getting the right nutrients in your diet, if you're not getting plenty of antioxidants, vitamins and minerals and essential fatty acids, you're also going to feel sluggish and run down. So it's probably related to your medication, but oftentimes you can counteract that by eating a very healthy diet. So organically grown fruits and vegetables, go to the store, buy the most colorful ones, the purple cabbage, the orange bell peppers, the dark green kale. Wash them very good, gently steam them, and start eating a lot of these fresh fruits and vegetables. That will help, all right?
All right, thank you for the call. I would have a suggestion, but it's too silly. I would say get a dog with a small bladder, and she will wake you up all night long.
That's the truth.
My dog wakes me up all night long. I don't know if you know this, Robin and I have been painting pictures outdoors for the last year. We've done 26 of them now. The problem that I wondered...
52 total.
Wow, musicians, talk show hosts, and artists.
That's right. Wow. So you have this big white canvas when you first start out, and when the sun is shining on it, I've often thought, is that going to be a problem eventually if we keep, every time we go out, we have this big, bright, white thing?
Yeah.
The glare, right? The reflection from the
Should we get
light.
artist sunglasses or something?
You absolutely, you should know this, Larry. You've been listening to this show, hosting this show for like 100 years now. You need to be wearing good sunglasses when you're out painting.
And that won't change the way the painting looks at the end?
The colors?
Get some neutral color, a neutral color sunglass. No, you'll still, as long as you're not wearing, don't wear a blue blocking sunglass because you're not going to have any blues in your painting. But just get a good sunglass. We can hook you up, and that's going to protect your eyes.
You are an all-around nutritionist, and with every facet of the human body, because it's not just the eyes that you pay attention to. You pay attention to everybody's overall well-being, and you individualize it for every patient that you have.
Well, the eye is the window to the body, and some people say it's the window to the soul. That's a whole nother show, but it's definitely the window to the body. And when we look in the eye, when we dilate your eyes, we're looking at the vasculature network, the arteries, the veins, the capillaries, the nerves. We can see how diseases are affecting your system, all right? We can also see how medications are affecting your system. This is why we have so many cardiologists and rheumatologists and primary care physicians that refer patients to Lange Eye Care, because we can determine if the medication is building up at toxic levels, and we can also determine if their diabetes, their high blood pressure, their elevated cholesterol, their hypertriglyceridemia, their collagen vascular disease, whether it's rheumatoid arthritis or sarcoid or lupus, how it's really affecting their vascular system by looking through the eye. So an eye exam is one of the best forms of prevention that we have today. an eye exam may not only save your vision, it may save your life. So certainly we're looking for eye diseases. We're looking for cataracts and glaucoma and macular degeneration, but we're also looking for general health problems. We can determine if you're a pending stroke. We can look for plaque buildup in your arteries and veins. If we see things like Hollenhurst plaques, then we know you're a pending stroke ready to happen. So we'll send you out to your cardiologist to try to keep you above ground a little bit longer. But also, who better than your optometrist or ophthalmologist to use nutritional intervention to help people? Because we can see how the proper diet is actually affecting your overall health through your eyes.
Doctor, we're out of time. Obviously, the best thing for anybody to do is to call you at your office. And again, what's your number?
The main number in Ocala is 237-3768. Check us out at drmicheallange.com. You can go to Facebook, which is just Micheal Lange on Facebook, or the Lange Sun and Nutrition Center, or Fortify Vitamins. And Facebook's a great way to actually educate, but also to keep everybody posted on the latest changes that are going on.
Yeah, definitely. And call us if you need the number repeated, or go to WOCA.com. Look under the guest list at 9:05 on Wednesday. You'll see Dr. Lange's information right there. Good to see you. Joe has a couch if you want to take a nap.
That's right. It's comfy.
We'll be right back.
Have a great day.
Ocala's information station, 1370 WOCA.
Ocala. The weather is brought to you by myfwc.com. Life jackets save lives. We're in Florida. Mostly sunny today and warm this afternoon with a high of 81 to 85. It'll be mainly clear tonight. Lows ranging from 52 in a few inland spots to 62 on